Thank you, Julie. We are joined tonight by Dr. James Alexander, a family practice physician from Harrisburg, also the director of medicine at the Harrisburg Medical Center, correct?
That's correct.
And you've been practicing medicine in this area about as long as I've been on air in this area.
I think that's correct.
More than 30 years, right?
Yes.
Okay, well, we thank you for being with us tonight. And you told us earlier, we were talking, and you said you like to take a one conversation approach with your patients in talking to them about COVID-19. What are these conversations like when you talk to people about COVID-19 and the vaccine?
So after this many years, a lot of my care is probably internal medicine. So I'm in that age group that's really going to be impacted. Those are the folks that I think should definitely get vaccinated if they missed out on the first round of vaccines from last year. That being said, if they don't take the vaccine, I talk to them just like I would for the risk factors for heart disease or a stroke. Now, you tell them, you have bad lungs, you have a bad heart, you're diabetic, you're hypertensive, you're way overweight. Not that all my patients are like that, but you try to spell it out that there are risk factors for a really bad event should they catch the virus or end up in the hospital. It's not going to be good.
Now, we're also seeing with this Delta variant, younger people impacted. We're hearing cases of people in their 20s who the first time around with COVID-19, that age group wasn't infected much, or if they were infected, they didn't show the signs that older people were. We're seeing more cases of younger people who appear to be healthy being significantly ill from the Delta variant. So do you have to have that conversation with a wider group of people now, not just older people who are overweight or lung problems? I mean, do you have to have that conversation with more people these days?
Yeah, parents are asking about their children, their children going off to college. They want to know about their children getting sick while they're gone. Nobody wants their child to get sick while they're away from home. But those questions are just as easy to answer. It's approved for age 12 plus. There are consequences or side effects. You shouldn't say consequences. But you try your best to convince them that what's the best for the patient, or what kind of impact are they going to have on other family members that maybe not be as healthy. The Delta variant, there's going to be enough variants until we run out of Greek letters and all that other stuff. So it's just a matter of time, and as a virus mutates, it's going to affect different demographics. And we don't know that some of the kids that are having, some of the children that are having the Delta now, they could have been affected last year and didn't have any symptoms, but this time they're getting sicker.
Now, what are some of the questions you're getting from people? What are some of the most asked questions concerning the vaccine?
Most of the questions are based around side effects. They have a friend, or they know of a person, or they read it on Facebook, or they saw it on social media. There's some push on social media about not getting the vaccine. A lot of folks are concerned that it hasn't been available, hasn't been studied that much. Yeah, we didn't have time. We didn't really have time to study it that much. We try to get something out as soon as possible. When you have a population of 350 million, you've got to do something drastic. And this is, these are trying times.
But as a physician, I know people come to you, they've been coming to you for 3 decades for your expertise and your opinions on their health care. Do you feel like people trust you now to give them sound advice on the vaccine?
Yeah, they do. We have the same discussions. Before COVID hit, we had discussions about pneumonia vaccines, influenza vaccines, the new shingles vaccine. You try to tell them that things have worked for years and years, all the way back to the polio vaccine.
And so then what do you tell them with this new vaccine when they say, doctor, if it was you in my shoes, would you go ahead and get it?
I had COVID. I had it in October last year. And they were just talking about the vaccine at the time. And when people would say, well, when I had it, I had no desire to get it again. So whatever method I had to do to prevent from getting it again, I didn't want any part of it.
So we're hearing a lot about medical staff being overwhelmed by caring for COVID-19 patients. ICU rooms, filled up, just an extra strain on staff. What is it like right now at the Harrisburg Medical Center?
I think half the patients we have in-house are actually COVID positive. Staffing's an issue. It's an issue for every hospital nationwide. Those nurses, those great nurses that are leaving to go for financial gain, and you can't blame them. You know, times are tough around here, but we're losing great nurses. If they come back, we welcome them with open arms. We'll take all the help we can get. So when they're gone, you just have that much more stress to put on the staff that you have left.
What do you tell your staff when you see them getting worn down? Because this fight with COVID-19, I think a lot of people in the general public, I don't know, maybe medical staff were more tuned in to what might happen with this, but I think a lot of folks in the general public thought, okay, we'll get through it, kind of like a flu season. It'll be gone, it'll be behind us, we'll be out doing everything like we used to do. But it's been more than 18 months that we've been in this battle. So what do you say to staff that have been fighting this long battle against this virus?
They had a report just recently from the CNO, it's a chief nursing officer, and it had one-word descriptions from nurses nationwide: resilience, humble, exhausting, heartbreaking. They're seeing these people back sometimes the second time. Maybe they're not doing as well the second time as they did the first time. They're tired. Mm-hmm. What do you say? Try your best to cheer them up and give them a, thank you very much. But that's usually not, it's never enough.
You told me earlier when we were talking that you have some people from various jobs, like state employees and people who are school teachers or hospital staff, are asking you about the vaccine. And so what kind of questions are you getting from them on whether they should get? I know not everybody is in favor of getting a vaccine in order to keep their job.
Yeah, people want an exemption. I'm more of a vaccine, I'm pro-vaccine, always have been. So it's hard for me to write an exemption unless they just were sick. There are some guidelines for those people that had one of the antibody infusions. Those people can have an exemption until it's so many months out. The other folks, I don't know if it's going to gain them anything. Financially, in times like this, can you afford to give up a job, benefits, insurance? This day and age, what if you give up your job and you get the COVID and the next thing you know you're in the hospital with nothing? Mm-hmm. Right. So that's a lot to put on a person, but at the same time, you have a family and you're going to lose your job for not doing it because it's mandated. Mm-hmm. Corporate mandates, they have teeth.
Mm-hmm. Earlier we were talking about your common sense approach based on 30 years of experience. So what is your common sense message based on your experience to people who are watching right now about COVID-19?
Wash your hands, wear your mask, cover your face when you cough. Kind of like it started, just like we learned in kindergarten, just exactly like you learned in kindergarten.
Still doing it.
Yeah, it's the same.
All right. Dr. Alexander, thank you for being with us tonight. We appreciate you coming.